Hello everyone, welcome to Tech Sharmit. From this session, we are going to start another series which is related to medical coding. Throughout this session, we will discuss about the basic things related to medical codings, and throughout the series we are going to cover all the aspects which comes across under the medical coding process. Okay, so by the end of the series, we will be having a good understanding of medical coding process. Will also cover the coding standards which are being used in order to perform medical coding. Okay, so these things we are going to discuss in upcoming days. It will also include some medical terminology like prefix, suffix, and all the related information which we usually use with the medical coding. Okay. So let's start with the basic thing first. So in this session, we will discuss about the basic definition of what is medical coding, because this is the first term that encounters whenever we are learning about this course or this process. So medical, to explain this thing, what I will do, I will show you one flow that will help you to understand the term medical coding. So let's go to it. So this picture is enough to explain the process of medical coding. So what is medical coding? Whenever we are converting, or you can say whenever we are transforming healthcare diagnosis, procedures, medical services, and equipment into universal medical alphanumeric code, then in that case, this entire process is called as medical coding. Coding means we are mapping some medical related information with some codes. Now, what is these codes? These codes are the you can say standard codes, right? What is like standard codes that is dependent on some sort of rules, some sort of policies, okay, and which is getting followed throughout the world. Okay, so whenever someone asks you what is medical coding, then in a simple terms you can explain a, a coder, like the person who is performing this coding is known as coder, right? Medical coder. So whenever we are converting or transforming healthcare diagnosis, procedures, medical service and equipment into universal medical alphanumeric codes, then that process is called as medical coding process. There, if you look at the right side box, we are using one term alphanumeric. What does it mean? It means the codes is created by the combination of characters as well as numeric values. Okay, and you can see here it is mentioned universal medical. It means it will be followed throughout the world. Like there are some types of coding standards that we are using in order to perform this medical coding process, that we will discuss in upcoming sessions, like what all standards we have and how we perform the coding, and to perform this coding we need to learn about the terminologies and other, there are many things that we need to take care of, right? But at the moment, as we are focusing only on the definition, so you can assume that there are some sort of medical code standard that we have to follow in order to transform the healthcare diagnosis or procedure or medical service equipment information into universal medical alphanumeric codes. Okay, so this type of transformation is known as medical coding. Okay, so as I told you that this right side box is we will discuss in more detail for this thing. But what is this? Healthcare diagnosis, procedures, medical service, and equipment. What is this? So these are the information that we collect with some by conducting some process. Okay, so to explain it in more detail, let me go to the next slide. Yeah. So this, if you look at the left box, to achieve or to acquire this information, what we can do, like what are the sources, you can say, what are the sources to acquire these information. So let's discuss that. So first thing is like there are I have categorized it into some parts. So let's discuss one by one. So first thing is direct clinical documentation. What does it mean? So there are multiple things that comes under direct clinical documentation. The first one is history and physical examination report. These reports document the patient presenting complaint, medical history, family history, social history, and finding from the physical examination. Okay, let's go back to the basic. As I told you, that medical coding is a process in which we are converting the healthcare diagnosis, procedures, medical service equipment into universal medical code. So then first question is why we are doing this, right? Because why we are performing this coding. So let's say if someone is facing some medical issues, there's one patient and who visited doctor in order to take the treatment. So during that treatment there are multiple process which is getting followed. Okay, so doctor will examine the patient and then he will provide some procedures and healthcare diagnosis report. Okay, and then that report is forwarded to medical coders. What they will do, they will align some code or they will map some code with the diagnosis report according to the diagnosis reported reports. Okay, and that medical coder will transfer those details to medical billing team, and then billing team will share it to insurance agent, then they will process the claims. So this medical coding is a part of, you can say, claim process for the medical billing or insurance. Okay, so throughout this session we will take some example and then we'll discuss like how it is going with the flow. Okay, so as I told you, the first thing is history and physical examination report. So just assume there is one patient who is facing some medical issues. So what he will do, he will visit the doctor. Then the doctor will check the patient by the complaints. He will look into the medical history of the patient because maybe there are some he has already visited many times to that the same doctor. So he will go and look out to the medical history, family history. Maybe he is facing some issues related to the heredity problems. So he will look into the family history as well, social history, finding from the physical examination, and he will physically examine that patient, and then he will generate some report. So that this is the one source through which we will get the direct clinical documentation, and then that documentation will be transferred. You can like these sources is for left block, right? And then these information are getting converted into universal medical alphanumeric codes. Now second thing, what is second thing? We have progress notes. What is this? Now assume that patient who has visited to doctor is like one patient is there who is admitted to the hospital. Now what he will do, the department will do, hospital management will do, uh, like it will prepare the progress note. Now what is progress notes? These notes track the patient progress throughout their stay in the healthcare facility. As I told you that he is admitted in hospital, so the department, the medical department will take a proper progress notes throughout the patient stay in the healthcare facility. He will note everything like you can see detailing changes in symptoms. The department or the medical doctors or medical team will note down detailing changes in symptoms, diagnostic tests, treatments, and the response to the medication. Because for sure, if he is hospitalized, then doctor are providing some medication to the patient. So they will also note and note the response of the medication, whether the medicine is working fine with the patient or not. So these all things comes under the progress notes. So the hospital team will prepare this progress notes, and this will also work as a direct clinical documentation and will be considered as consider for this left block information. Okay, then this information is getting converted into universal medical alphanumeric codes. Then we have third thing is discharge summaries. What is discharge summary? These summaries provide a concise overview of the patient entire encounter, including diagnosis, procedures performed, medication prescribed, and follow-up instruction. So whenever that patient who is admitted in hospital leaves the hospital, got discharged, in this case, hospital management provides a summary, And what this summary will hold? It holds all the information related to the diagnosis, procedures performed, medication prescribed, and all the follow-up instructions. So this is also one of the source for medical documentation. Okay. At the end, we are going to discuss all the sources which we are using in order to prepare the medical codes, or which we are using in order to map the medical code. Then we have consultation report. What is consultation reports? Reports from specialists consulted during the patient's care and can offer additional insight of the diagnosis. For sure, there is a consultation team in the hospital, so they will consult and who is specialist and prepare some consultation report that can be used as a source of the medical documentation. Then we have laboratory reports or lab reports. These reports detail the result of blood tests, urine tests, tissue samples, and other lab investigation. Okay, let's say if someone is facing some medical issues and he has visited the doctor, and doctor has asked him to bring the blood test report. So these reports are also used as a source for the medical coding, right? Because from this documentation itself, from the lab report itself, we will get some information, and that the medical coder team will convert or map these information into medical codes by using some of the standards. So lab report is also one of the source for the medical documentation. Then we have pathology report. These reports provide microscopic analysis of tissues, sample to diagnosis tissues, diseases. Okay. Then we have imaging report. It is These are the most commonly used terms, right? These report interpret X-rays, CT scan, MRIs, and other imaging studies to identify the anatomical abnormalities. Okay. Then we have ECG report. These reports measure the electrical activity of the heart and can diagnose arrhythmias and other cardiac conditions. Okay, so these are the all the sources which act as a medical document, and then these documents are being utilized in order to convert the uh, information into medical codes. All right. Apart from these, there are many some other sources as well, which are like these operative reports. These report detail the surgical procedure performed on the patient, including incision site, instrument used, and complication encountered. So these are considered as a operative reports. Then we have anesthesia reports. These reports document the anesthesia administered during the surgery and any related complication. There is one more term used, which is nursing notes. So although it is not directly used, as here it is mentioned, while not always used directly for coding, nursing notes can provide additional information about the patient condition and response to the treatment. Okay, the the coding team is not getting it's not directly using these notes, nursing notes, but they always prefer, or you can say they look at these information as a additional information whenever it is required. Okay. Then we have medical record from healthcare providers. If the patient has seen other healthcare providers for same condition, their records may be reviewed for the additional diagnosis and procedures. Okay, so these are some sources which act as a medical documentation, which we are using in order to perform medical coding. Okay, so what we have learned in this session, we have learned how what is medical coding, what all sources we can use as a medical document. So if if we talk about the coding process, then you can say whenever we are converting or whenever we are transforming healthcare diagnosis procedure medical service and equipment into universal medical alphanumeric codes, then this entire process is known as medical coding. And there are multiple sources which we can use as a medical documentation, which comes under three categories: direct clinical documentation, diagnostic studies, and other sources. Okay, and which are which contains multiple points like progress note, discharge summary, consultation report. So these are all the information. Although it is totally depend on the hospital and the management who is taking care of these things, because maybe any other report is included as per the need of the patient. Okay, so these things are totally dependent on a hospital as well, or the healthcare provider as well. But overall, these are the steps which are being used in order to perform the medical coding. Okay, so yeah, these are the things which I want to tell you in this session. In next session we will discuss few more things. So thank you for watching Tech Sharmat.